So generally when we book in for a child session for counselling, we generally recommend that you book an 80-minute session. And this is really so that we can have some time with the family and the child together, because it gives me a really good opportunity to sort of see the family dynamic. Often parents say things that children won't, so that gives me a really good chance to hear what the parents are going to say in front of the children. We also talk about confidentiality at the beginning part of that session, because it's really important that I want the child to feel that it's a safe space. So I'll talk about the kind of different types of confidentiality and how, if I feel that the child is at risk to themselves or someone else, then I'll have to share that information on a kind of piece by piece basis. But I'll also be informing the child of that, or we'll do it together, so that the child feels they can share any information with me. So generally we book an 80-minute session. The parents need to sign the informed consent. Then we have about 20 or 30 minutes together as a family. And then I tend to like to see the child by themselves. So, and that's really just to see what they feel in terms of whether it's the same issues that the parents say. So I might ask questions around the current situation, the reasons why they booked for the therapy. I might ask about medication, sleeping, relationships, just kind of generally lots of questions around the background, and I'll form an initial assessment, I guess, within that period. But I want people to feel that it's really collaborative, so that it's their opportunity to ask any questions of me, and I try to make it quite kind of upbeat and fun, and not too, so that the child doesn't get too nervous. So yeah, we tend to have a bit of time together as with the child, and I might play some games depending on the age of the child. I normally see children 8 and above, but we might use these kind of dice, for example. What do you want to be when you're older? Or name a time when you were embarrassed. Now these are just kind of conversation starters. We call them emotional literacy games. And they enable us to kind of get to know the child in a kind of informal setting. So once we've done that, we'll often then bring the parents back into the room, and I'll present an initial kind of treatment plan and answer any questions that the parents might have. We tend to use lots of different modalities. So with an older child, it might be more talking based. With a younger child, it might be more games. Using drawing and art and drama, but it really depends on the interests of the child. So I'll want to find that out in the first session as well, and then I'll modify the forthcoming sessions as the child sees fit and the family sees fit. So that's kind of how the sort of things you might expect in a first session.